Hello, lovely. It's Dr. Nicola. I believe you lost consciousness earlier. All right, my lovely. Let me just have a look at your notes and see what the nurse has said. Okay. So... Okay. I do need to assess you straight away if that's okay, my lovely. Alright, so I will have to remove the oxygen and turn the lights on. Okay, my love. Okay, we'll just take that. Okay. Are you okay, lovely? Are the lights okay? I know. They are a little bit bright, but I do need to carry out some checks, okay? How do you feel now? Yeah, that's understandable. Let me just take a look at you. Yeah, you are still quite pale. Alright. Now, please try and stay nice and still for me, okay? Yeah, and please try to stay awake. Okay, my love. So, can you tell me your full name, please? Your date of birth? Do you know where you are right now? And do you know what day it is? Now, do you remember what you were doing before you lost consciousness? Yeah? Okay. And that's all you can remember? Alright, did you have any warning signs? Dizziness, blurred vision, nausea, headaches? Yeah, okay. Throughout the day, okay. Ah, okay. Okay. Has anything like this happened before? Okay, so it's the first time. Okay, my love. So, you're obviously aware of your surroundings, okay, which is really good. Alright. Now, I know you've been through a lot today, but I do have to carry out some important checks now, okay? Alright. We'll have to have a look in your eyes with my light and it will be bright, okay? Alright. Okay. So you can just look straight at me, okay? Okay. Right. Okay. Okay, all right. Just look straight ahead for me. I know it's bright, my love. Okay, now just with your eyes, could you look up for me? Okay, back at me. You could look that way. And that way. Back at me. Now just try to look down with your eyes. Okay, just look at my light. Now just for your eyes, can you just follow it? Okay, good. That's it, look that way. Back. That way. Okay, now follow it up and down. Okay. These are quite glazed over, my lovely. Alright. Your pupils aren't quite reacting as they should. Okay. Now, would you mind just repeating these words for me, okay? Apple, green, table. Apple, green, table. Good. Now, can you say them backwards? Good job. Now, can you count 1 to 10 for me? Okay. Now, can you count backwards from 20? Alright, don't worry. Okay, a little bit disorientated with that. Okay, just relax, okay. Do you remember what those 3 words were? Okay, good job. Okay. Now I'm going to check your temperature, my love. Alright. I'm going to pop it on your forehead. Okay, now can I pop it in your ears? There you go. And just double check the other side. Okay, your temperature is okay. It's probably a little bit on the cooler side, but that's fine. Now, I know the nurse checked your pulse and oxygen levels, but I would like to do that again, okay? So if you can pop your index finger just in there for me, okay? That's it, and just relax it on you. Your oxygen levels have improved from earlier. That must have been the oxygen that you were given. Your pulse has stayed the same though, my love. Alright. Now if I can just have your wrist. Okay, I'm just going to check your pulse manually. Okay. Now, can you take a nice deep breath in for me? And out. And in. And out. Okay. Okay, just going to have a feel around your face, okay? Let me know if you feel any pain or weird sensations. Okay, alright. Let's check your glands. Okay, that's fine. Okay. I'm just gonna have a feel around your scalp, okay? I can't feel any lumps or bumps. Just hold it. So I can't see any cuts either. It doesn't appear that you've banged your head, which is good, but we can't rule that out. Alright. Okay, I'm just gonna have a look here. That's okay. Okay, that's fine as well. Okay, now you just squeeze my 2 fingers. Can you be a bit harder? Okay, release. Okay, now this hand, same again. A bit harder. Okay, good. Now hold my hand, squeeze, release, squeeze, tighter, and release. Good job. Other side. On my hand, squeeze, release, squeeze, tighter, and release. Good job. Now hold with both hands. Here we go. Okay. Squeeze, release, squeeze, tighter, and release. Good job. Little bit on the weak side, but that is expected. Alright, my love. Okay. Can you feel this? Yeah? You can feel that? That. Okay, good. Temples. Okay. I'm going to pull down your eye and have a look. And up. Other one. And up. Right. Okay, pulling down. Bring in my light. Okay, and down. And just open your mouth for me, my love. Can you say "ah"? Your mouth does look very dry. Do you feel quite thirsty? Okay. close your eyes. Open, close, open, close, open, close, open, close. Alright. Now with your left hand, can you touch your nose? Okay, now with your right hand. Now with your left and your right. Okay, relax. Now, can you try and lift your arms up for me? Good job. And down. Now, can you just lift your right arm? Good. And now your left. And relax. Any pain or discomfort or weird sensations doing any of those activities? Okay. Put your hands against mine. Okay, now can you just push me? You put a bit more effort in. Okay, now try again. I'm going to push you. Okay, so you're quite weak, aren't you, my love? Alright. Are you feeling quite tired? Ah, hello. Okay, so dehydration. I did think so. Yeah, the mouth appears very dry. Yeah, that's classic dehydration. Yeah, I did see that actually in the urine. So there's dehydration, but no signs of infection or anything abnormal in the urine. Okay. And what else did you find? Okay. And you did the bloods, didn't you? Yeah. Have they come back yet? Right, okay. Thank you for letting me know, but if you wouldn't mind just getting me some IV drip so I can huck them up so we can start hydrating them. That would be brilliant. Alright, thank you very much. You're okay? Good. So you may have heard that you're showing signs of dehydration and quite severely, so we do need to get you on a drip, my love. Alright, but at the present there's no signs of infection, but we haven't had all the blood test results back yet, so we can't be 100% sure on that. Okay. Yeah, okay. Now, do you feel able to stand at all? Okay. So on the bed, could you put your feet together? Yeah. Okay, can you put them like together like that as well? Okay, that's fine, thank you. I won't get you to get out of bed, my love. You're quite clearly too weak for that, so we're going to leave you there. Okay. Now, are you experiencing any chest pain? Any headache at the moment? Okay, so where you told me before. Okay. What about your vision at the moment? A little bit blurry, but okay, okay. Have you had any recent illnesses? No. Okay. Have you eaten today? What have you had? Yeah. Okay. Is that everything? Okay, so you wasn't feeling the best. Okay. What about water? Have you had a lot to drink today? And if so, what kind of things have you been drinking? Okay, so you have had some fluids. Right. So you had squash. Okay, because you are quite severely dehydrated, my lovely, which is concerning, considering you've had, drinks. Alright. I mean, you do appear, you are stable, you're not passing out or anything, which is good. But there's something going on. Okay. How are you feeling? Yeah. Alright. So I will be keeping you in. I'm not 100% sure what happened or why, so we do need to carry out some further tests and you need to be kept in on observation. Now, you are showing signs of a slight concussion. Now, I can't find any evidence on your head that you banged your head, but as I said earlier, that doesn't mean that you haven't. Alright, so you do need to be kept in and monitored regularly. Alright, my lovely. Now, as I said, you are severely dehydrated as well, so the nurse will be bringing your drip through shortly and I can pop that in for you. Alright. Now, as your oxygen levels have rose, I don't feel giving you oxygen at this stage is necessary, but it is available if it is needed. Alright. Now, I am wondering if you've had a seizure or a mini stroke. Alright, and I know that sounds a little bit scary, but you're here now and you're being monitored just in case, another one happens. Alright, okay. But it's nothing to worry about. You'll be having some scans and an EEG to check your brain waves. Alright, my lovely. Okay. And then, whatever the findings are, we can go ahead with some treatment. Alright. Okay. I know, but you're perfectly safe here, okay, my lovely? If you need anything at all, please don't hesitate to call one of the nurses over. Alright, I will be bobbing around seeing different patients, but if I am needed, I can come back, but it's the nurse's duty to look after you. Alright, and I'm basically just confirming that there is something going on, as the nurse did think you were experiencing slight concussion. But after my checks and bloods and things, I do think there was something going on beforehand. Yeah, and it can build up with how you were feeling through the day. But obviously without these tests, I don't know for definite. Alright, my lovely. Okay. So, you need to just get yourself nice and comfortable, but you can't go to sleep anytime soon, my lovely. Alright, we do need to try and keep you awake a little bit. Alright, so you can have access to the TV and things. Alright, but we're going to have to get this drip in you. So I'm going to prep you and pop it in a cannula, and I will need to do that anyway because if you need any fluids or antibiotics or anything else, it needs to go through that. Okay, so we'll be doing that for you in a moment. Okay, and then obviously getting you some hydration. Okay, and then when that's gone through, you can start to rest then. All right. Okay. Is your head still hurting? All right. It's quite a lot. Yeah. All right. I can give you some pain relief as well then, my lovely, and I'll pop it through your cannula. It'll work much more effective that way. All right. Now, is there anything that you need to tell me that you can remember, or you think, might be relevant? Even if it's not, is there anything you'd like me to know? All right. Okay, my lovely. Try not to worry. Okay, we'll get this sorted for you. Okay. Perfect. Just bring it round. Thank you. Great. Looks perfect. Okay. I don't mind, I'll do this, it's not a problem. If you can go and get me some pain relief, I can get that in the IV as well. Yeah. Yes, please. If you could bring me one of those as well, that'd be fantastic. Okay, thank you. so I'm going to have to pop it in this one if that's all right. Let me just check that. Okay, let's rest there for me. Ah, thank you very much. Okay, do you have any allergies, my love? Okay. So, I can have your wrist. Okay, now this is just your admission band, okay? Let's put that there and do that up. Comfy? Good. Okay, so that's you officially admitted, my lovely. Alright. And that means we have the cannula. Okay, lovely. Okay, I can have your hand. Okay, short scratch, my love. That's it, well done. Okay. That's that. Perfect. Okay. Okay, does that feel okay? Good. So I'm just going to get some of this now. Okay. There we go. A bit sore, yeah, it will be. Okay, it's fine. Let me just do that. Okay, pop that there. Right, that is in. Now you will start to feel this in a moment go through you. You'll find you could feel it go round, okay, and you will get used to it. And it may sting a little bit in your hand, okay. Okay, you should start to feel that any second now. Okay, it's very weird, isn't it? Okay, that looks fine. Nicely does it. That back there. Okay, can you feel that? Good. Okay. Perfect. So the time is... Okay. So you may need to have 2 of these, okay? Okay. Right, so you may need to have 2. Okay. Try to keep them awake, especially while we're getting this one through. Alright. I can come back around later just to double check. Yeah. Yeah, and I will get the scans and EEG arranged as well. Yeah. Okay, so if we are treating for slight concussion and suspected seizure or TIA. Okay, mini stroke. Yeah. Okay. Yeah, and just you know what's what. But if you are concerned about anything, just drop me a line and I can come back up. Yeah. All right. Okay, my lovely. I'm gonna have to go now. All right, and let you rest up, and this lovely lady will look after you. All right. Yeah, Judy, she will look after you. Yeah, you're in safe hands with her. Alright, we are a little bit quiet at the moment here in the emergency room, so, you know, she can keep you company a little bit if you would like. Yeah? Alright. Are you still cold? Yeah, could you get some blankets? Would you like an extra pillow? Extra pillow. And some fresh water, please. And, yeah, that'd be it, I think. Yeah. While you're doing that, I'll pop in the pain relief. Okay, let's give you this pain relief, my love. This may make you a bit drowsy. Okay, you may feel this going round. It will feel a bit warm. Good job. There we go. You won't be able to have any more of that for a while now. Okay, so hopefully I'll do the job. Now, if your symptoms get worse or you don't feel well or anything, please press the buzzer. Alright, and one of the nurses will come. But I'll leave you with Judy now. Alright. You're very welcome, my lovely. Do you have any questions? Okay. Rest up. Alright. Get some sleep in a little while. And we'll carry out some further tests and see what's happened. Now, I will see you soon. Alright. You take care, lovely.